How does the skull relate to headache pain? Imagine your head as a complex puzzle where many pieces work together. The skull is a key piece, but it's not the source of headache pain itself. That's because the skull bones do not have pain receptors. So, when you feel a headache, it's not the bones that are hurting. Instead, pain comes from structures connected to or around the skull. The upper part of your neck, especially the first 3 cervical vertebrae, plays a big role. These bones sit right at the base of the skull and are called the atlas, axis, and the 3rd cervical vertebra. They help your head move and support it. When these vertebrae or the muscles and ligaments around them become irritated or tense, they can send pain signals that you feel as a headache. Nerves are the messengers here. The nerves that sense pain in your head and neck come from 2 main sources. One is the upper cervical spinal nerves, which include the 1st, 2nd, and 3rd nerves. The other is the trigeminal nerve, a large nerve that supplies sensation to your face and the covering of your brain called the dura mater. The dura is a tough membrane inside your skull that protects your brain. When these nerves get activated or irritated, they send signals to your brain that you interpret as pain. This can happen if blood vessels inside or outside your skull become inflamed or dilated. These blood vessels are sensitive and have pain receptors. When they expand or become inflamed, they can trigger pain signals. The trigeminal nerve plays a big role here by releasing chemicals called neuropeptides that cause blood vessels to swell and become inflamed. This process is common in migraines and other headaches. The muscles and tissues in your neck and around your skull also matter. If you have tension or dysfunction in these areas, they can irritate the nerves that connect to your head. That's why poor posture or neck movement can make headaches worse or change where they hurt. In short, your skull itself isn't the pain source. Instead, the pain comes from the nerves, blood vessels, muscles, and membranes connected to or near the skull. Understanding how these parts work together helps doctors figure out what kind of headache you have and how best to treat it. Whether it's relaxing tense muscles, improving posture, or medications that target nerve signals, knowing this connection makes a big difference in managing headache pain.